name's Jared Reisner. I'm the clinical director and one of the respiratory therapists on staff at Affordable Medical Supplies. If you're watching this video, you're either at one of our locations, have visited or registered with one of our locations, or maybe you're just watching from home. Either way, we're glad you joined us. We're so thankful to be able to assist you with your sleep health and to have been provided this opportunity to educate and empower our patients. So with that, before we get started discussing your machine today, I did want to briefly go over what sleep apnea is and some of the concerns associated around untreated sleep apnea. Your physician may or may not have discussed this with you, but we always like to do this with our patients just to make sure that you feel comfortable about what all this is even for. So, sleep apnea. The issue with sleep apnea is that you really have something called an obstruction, and that sounds crazier than it really is. It's actually just tissue. If you have the upper airway and the bottom airway, the soft tissue just kind of collapses once you get into your sleep. The problem that causes is we have an obstruction. So it doesn't mean your body's not breathing the way that it needs to breathe. It actually still knows how to do everything it's supposed to do. But now we've got something in the way. We've got a wall there. So we need to move that out of the way. But while we have a wall, the reason that this is an issue, it's not just because it makes us sleepy or drowsy. I always make this cheesy joke that we could really care less about how you're sleeping. We're concerned about some of the long-term effects. And that's obviously not true. We absolutely care about how you're sleeping and how you feel. But the long-term effects are serious. So long-term effects of untreated sleep apnea is increased chance of heart attack and stroke. Now, obviously, it's a big deal. Everybody knows what those two things are. So to decrease the chance of heart attack and stroke, it's as simple as doing the therapy that your physician has prescribed for you. So in this instance, in sleep apnea, we can decrease that chance of heart attack and stroke by wearing our CPAP or BiPAP, which just adds positive pressure through the airway, and it just opens that airway up. So it's not breathing for you. It's not putting air into your lungs like a ventilator would. It's really just opening up the airway to allow your body to do what it already naturally wants to do. The benefit of that is over time, it decreases that chance of heart attack and stroke. And on the side, we improve your sleep quality, which means we're decreasing that chance of daytime sleepiness and drowsiness, which means we're having less frequent bathroom breaks throughout the night because our kidneys are getting to relax like they're supposed to in their deep sleep. So there's a ton of side benefits of sleep apnea that help with those long-term effects. So with that, if you ever have any questions or concerns, please feel free to reach out to us. We'd be happy to further educate on that. We want to be here to help you. But now, let's get started by talking about the machine, the use of it, and the general care of it, so that you can feel equipped and ready to treat your sleep apnea. The first thing you'll notice is that we have two seemingly identical machines here, with the exception of color, of course. But in reality, we actually have two different therapies. We have a CPAP therapy and a BiPAP therapy. Depending on your specific sleep apnea diagnosis, your physician will have prescribed one therapy or the other in order to correct or help your airway. Now, with that, there's some good news here. These machines are cared for the same way. The general use, care, and instruction of the machine is identical. So whether you're using a BiPAP today or whether you're using a CPAP, follow along because the instruction is going to remain the same. Today, we're going to be using a CPAP for instruction purposes only, but again, the BiPAP instruct is the same. So feel free to follow along with us. Before we start talking about the internal settings of the machine and how to adjust some of those comfort settings, let's first just talk about the general care and instruction of some of the things on the outside. So I want to first point out that we have a CPAP and a humidifier. So we actually have two machines built in one just to save you a little bit of space at your bedside. So you have the CPAP, which helps with your therapy, but we also have a humidifier to help with things like dry sinuses and dry mouth. It's important to point out that the humidifier doesn't always 100% cure dry mouth and dry sinuses because everybody's different, and sometimes we're even taking medications that can cause us to have more of those issues. If you ever have any questions or concerns, feel free to reach out to us here at Affordable. But for now, let's talk about how we use the humidifier. So we've got this opening where the humidifier is, and we've got a water chamber. Now, water chamber only fits in one way. You can slide it in right like that. To take it out, let's take it out together by squeezing it and just kind of wiggle it. It's tight when it's new. So you want to pull it out. You've got a lid here that opens up. So you just pry back on that and it pops open, and that's where you would fill the water. So you do have to have water for humidity, but you don't have to have water for therapy. So the water is only for the humidifier. You're going to use distilled water only. Fill it up in your chamber here to your max fill line. So you do have a max fill line and a minimum fill line if you find that there on your water chamber. Once you have the water in it, close it up by squeezing it. And again, it only fits the machine one way. So you can't put it in backwards or upside down or anything like that. You just push it all the way in and you're good to go. The amount of water you use depends and changes on the weather. If it's Arkansas in summer, you might find that you're not going through a lot of humidity because we have enough outside. But if it's the dead of winter, you might find that it's a cool, dry climate and that you're using water every single night. Again, the amount doesn't matter. Just know as long as you've got water, you can get the humidity, but that you don't have to have it. It's solely for comfort, okay? All right, now on the back side here, this is where we plug in your tubing, and I'll go into more detail about that in just a little bit. This is where we're gonna plug in your power supply. So in your bag, you'll have a power supply that's pre-assembled for you. You're gonna pull it out, and this end right here is going to plug in directly into the back of the machine. Some good news here, we can't plug it in wrong. You just push it in there and your machine will automatically turn itself on. So don't be alarmed by all the lights and everything turning on once you plug it in there. On the far side here, you'll notice this kind of graded look here. That's actually where your filter is. So you can just push on the tab there to check it. And you have a disposable filter, not washable. Don't wash the filter. It will clog it up and it'll keep your machine from being able to breathe. The good news here is we're going to provide you with a pack of 6 to get you started, and any filters you need in the future can be picked up here or at any of our locations. Some insurances will cover them, some won't, but they're pretty affordable. Just reach out to us if you need some. We'll be able to help you out. No top or bottom, doesn't matter how you put it in there. Just set it back in the rectangular tray like that and close it back up. On this side here, you have some slots for some memory cards, such as SD cards, but this particular machine has an internal memory, so we don't have to have those SD cards. You can put one in there if you'd like, but there's some other really neat features to this machine. So one of the reasons I don't really get too concerned about having an SD card in there is that this particular machine is online. You don't have to have internet, don't have to have Wi-Fi, you don't have to press any buttons or hook anything up. As long as you've got electricity, this machine will transmit your sleep health data to your physician's office or to my office through a private HIPAA regulated website. So if you ever have any questions or concerns, a lot of times we can even help you online without you having to bring the machine into the store. If you're going to see your physician, many physicians have that service as well, but check with your doctor first, because a lot of times they do want you to go ahead and bring the machine in case they need to educate or help you with it. Now that we've talked about the outside of the machine, let's talk about how to use it. How do we start and stop our therapy, and how do we adjust some of those comfort settings that might help our therapy along? Now, the prescription is set for you. We're never going to ask you to set that. We're never going to ask you to change it. Your doctor has prescribed it at a set number to help you with your therapy. To use the CPAP, we have a start and stop button on top, and it's the same way on your BiPAP. One button, it doesn't matter where you press it, it's your start and your stop. You'll notice it says start on one side and stop on the other. It doesn't matter which side you press, just the one button on top. So to start your therapy, you just press it one time. You're gonna notice the therapy because it's gonna start blowing. If you have your mask on, it should be pretty quiet, should have a good seal, and you'll see on the front screen here it'll light up. Now I do wanna point out that after 5 seconds of use, this screen is gonna go black. The purpose of that is so that the therapy isn't bothering you, or excuse me, the therapy light isn't bothering you while you're sleeping, but it is still running, if you can hear that. To wake it up, to look and see what your therapy is doing, you can press any of the buttons on the front screen here. You can rotate this knob, or you could press that home button. It would wake it up and show you what's going on. So you'll notice that on this front screen here, while the therapy is running, you have your prescription start pressure, which is called a ramp time, and we'll discuss that further in a little bit. You have the prescription itself, which is what the doctor has set for you. And then at the lower end of your screen here, you'll have the ramp time. And on the far right of your screen, you'll have what's called a humidity number. And again, we'll show you how to adjust that here shortly. So with our machine running, how do we turn it off? We said it's the same button, so we press the same button to turn it off, and now our therapy has stopped. That doesn't mean the machine is turned off. So it's sort of like a computer in that way. If it's plugged in, it's on. but it doesn't necessarily mean it's doing something. So plugged in means we have power, start means we're starting our therapy, stop means we're stopping our therapy. So along with our therapy, we have some of those comfort settings within the machine here. That's what I want to show you how to adjust. You can wake it up again by using the knob or pressing the home button here. You have two options. You have your sleep report and your settings here. So we use the knob to get around, highlight my settings, select it with the round knob. The first thing that you'll see is your ramp time. So ramp time is set on auto, and what that does is if your prescription is at, just for example, 15, it will start at a lower pressure that's easier to breathe on, that allows you to fall asleep, and then over a set amount of time, or if it's set on auto, it's gonna wait until you have an apnea and then go to your prescription setting. It just makes it significantly more comfortable and easier to sleep with. A good trick for people who are new to sleep therapy. If you have your ramp time turned on, if at any point you feel like the pressure is blowing too hard, stop your machine and restart it. You can do it instantly, you don't have to wait, you can do it 1,000 times a night. It'll lower that pressure back down, make it easier for you to breathe, fall back to sleep, and then get the therapy you need based on the machine's understanding of how you're sleeping. So you can adjust that by selecting your ramp time here to a time where it's going to start at a low pressure and build up pressure over time to help you with your sleep therapy, or you can set it on auto, which is where I think new PAP users should be, and let the machine decide for you, where it's never going to climb up unless you have an obstruction of some sort. You can set it on auto, select it to save it. If you're ever curious to know if you saved it the way that you needed to, you can actually start your machine and look on your front screen, and it will show you the settings that you've saved. Now, to get back to that settings screen, we have a shortcut. We have a home button. There's a little house on here. I don't know if you can see that or not, but if we press the home button, it takes us to the home screen. The purpose of the home screen is just a starting point. It's sort of like base camp to get to wherever else you need to go. So once you're at the home screen, we can go back into our settings, or we can view what's called a sleep report by using our knob right here. So going back into our settings, we discussed our ramp time earlier, where we can set a timer, we can set it on auto, we can even turn it off if we need to. I'll click it to save it. But moving down the line, we have something called humidity level. Now this is a feature of the machine that you're probably going to use more than any other setting on your machine. And that's because it changes depending on what the weather's doing. So if it's warm and humid outside, you may find that you don't want a lot of humidity. Or if it's dry and cold, you might find that you're turning it up. The thing that you need to remember about humidity is that it's solely for comfort. Everybody's different. A wife and a husband in the same bed, in the same bedroom, in the same house may set their humidity completely differently. Just know that it's solely for comfort and it doesn't affect the therapy as long as you feel good. That's the key. Do you feel good with it? If you don't, adjust it. If you have any questions about it, please call. We'd be happy to help you with it. So in your settings here, if we wake it back up, we're on our humidity level. If I select it, I've got a number system. I've got 1 through 8 with 0 being off, meaning no humidity at all. Whether you've got water in there or not, 0 means it will not heat up. Okay, so with our number system, this is really hard. Are you ready? Smaller number, less humidity. Bigger number, more humidity. But remember, in order to have humidity, you have to have heat. That's how humidity works. If you think about a July summer day, it's hot and humid. And that's when you get that moisture, right? So the same way with a humidifier in a machine. Bigger number, more heat, more moisture. So if you had dry mouth or dry sinuses, we want that number going up. Or in the opposite direction, if we felt congested or stuffy, we might want to be turning that air down to get a cooler temperature. Not an air conditioner, but less heat. To save it, you select it again, lock it in there. You can check it again to make sure you saved it if you want it by starting the machine. Now, there's something that changes your humidity here. If your insurance covers for you to have what's called heated climate control tubing, it will actually click into the back of the machine and it will adjust your humidity. What it does is it has a temperature probe that sort of measures the temperature around you and auto adjusts the humidity for you based on the temperature that it's reading. That sounds crazy and technical, but really it's plug it in, let it do the work for you. If you don't like it, you can always turn it off. So that's what I want to show you how to plug in real quick, because it is going to change our humidity settings. Heated climate control tubing will look like this. It's 6 foot long, so it's a good length of tubing here. And you have two different types of ends. You have a universal end that will fit any type of CPAP mask you own from any company. That's on purpose, that's to protect you. So if the CPAP doesn't fit, there's two things going on. It's either not supposed to because it's not the proper type of mask you should be wearing at home, or there's a fitting that has disconnected within the tubing. The easiest way to check is it should slide on easy to the mask. If the fitting is stuck, you won't be able to squeeze the tubing. If you can squeeze it, it's ready to fit any home CPAP mask or BiPAP mask that you could own. On the other end of the tubing here, you actually have the connector that's going to allow the machine to recognize the tube in order to do that measurement. So flipping the machine around here, you'll notice that we do have the temperature probe connector there. We're going to line it up and you're going to hear it snap. Kind of like that. When you hear the click, you have it where it needs to be. You can swivel to whatever side of the bed you need it to be on, and you just squeeze the tube to pull it out. Next time you would plug it in whichever direction that connector needed again. So you just push it in there, listen for the snap, and you're good to go. Now once you plug in your tubing, if you have climate control tubing, you'll get a pop-up that says climate control connected. And what it's doing is it's telling you that it recognized the tube. So the same screen that you and I just went over, where I showed you how to adjust the humidifier 1 through 8, now says a couple of different things. It says climate control auto and tube temperature auto. And that's because, again, we've recognized the tubing. It's going to try to measure for us and auto adjust the humidity for us. The whole purpose of that is to try to help you get the amount of humidity that you need based on your environment, and to reduce the amount of condensation buildup that can sometimes happen in PAP tubing. Now again, if you don't like it, it's no big deal. I always say it's a computer. How in the world can it know how you feel? It can't. It can only take an educated guess, right? So how do we turn it off? On that same screen there, we're going to go down to climate control auto, and we're going to select it. My only other option is either cancel or manual. So to switch it to where you can adjust it yourself, we're going to switch to manual. We're going to select it. Look what happened. Now our tube temperature has a number, and we have a humidity level again. Well, we already discussed humidity level 1 through 8, bigger numbers more, smaller numbers less. So the only oddball is this new one called a tube temperature. So if we look at that, you'll notice that it's an actual Fahrenheit temperature. So what you're choosing is what degree temperature do you want your tubing to get up to. The sole purpose of that is to cut out condensation. Typically on auto, the machine's going to measure and try to do it for you. In a manual setting, you're going to have to use some reasoning with yourself to adjust it. For example, if you have condensation in your tubing, you need to think cold tube. Simple enough. If my tube is too cold and I'm running warm air through it, I'm going to get condensation. So I need to warm my tube up. So cold tube means condensation. How do I fix it? I heat the tube up. And we do that by adjusting the tube temperature. A really easy, simple way to start. Everyone wants to know, where do I start? We're going to go to just a few degrees above what you keep your house set at. Because if we talked about a cold tube, maybe your house is cooler. That's okay. You don't have to make your house warmer. We can make the tube warmer. So if you keep your house at 70 degrees, for example, we could set this around 72 or 73 just as a place to start. And then again, we would pay attention to it. The next day, do we have condensation? Yeah, I do have a little bit of condensation. We're gonna turn it up just a little bit. And you do that every day until you hit the sweet spot for your house and for the temperature and the weather and everything that's going on outside, and it should cut out that condensation for you. Again, select it to save it. Now, moving down the line here, you have another option here that says mask. That's simply selecting the type of mask that you're wearing. If you click into it, there are 3 different types of masks that people wear. You have one called a nasal pillow, which fits right into the nostrils. Some of them fit underneath. You have one that is called a nasal mask, which fits around the nose. And then there's a full face mask, which fits nose and mouth. And you just select the mask type that you're using. Helps the machine to understand how to help you, and click it to save it. At the very bottom here, you have something called Run Mask Fit. If we click on that, it's actually going to start the machine, and it's going to run the machine at a higher amount of pressure. That's so that you can test and fit your mask with a higher amount of pressure to see if it's going to seal well in the middle of the night when the pressure climbs up to your prescription. Some people like to do that, some don't. As long as you're comfortable, it's okay. So to check that, we just click it. It'll let us know if we have a leak by giving us a sad face. If we have a happy face, our leak is okay. And then we can turn it off with our start and stop button there. At the very bottom of the screen here, you have something called Run Warmup and Airplane Mode. Run Warmup is a simple preheat. It's like throwing a pot of water on the stove to cook some macaroni. We don't have the macaroni in there yet, we're just heating up the water. And that's what your Run Warmup button will do if you select it. Good news, if you forget about your machine, it will not overheat, it won't get hotter and hotter and hotter. It'll actually abandon the warm-up after about 15 minutes. Otherwise, if you came to bed while it was preheating, when you hit start, it ends that run warm-up and it just starts from that exact point there. Solely for comfort, you do not have to do that. Don't overthink it. If all you did was come to bed, put your mask on and hit start, you would be just fine. But some people like to preheat the water because they don't like it to start cooler. Airplane mode turns off data. So if you were to turn airplane mode on, it would actually shut down all the data. So the data that your physician can see, the data that I can see, any of the ways that we'd be able to help you remotely from our computer system, we would no longer be able to help you in that way. So we do ask that you leave airplane mode alone, but we understand that some people really prefer their privacy. So if that's something that you wanted to implement, you can turn that on and keep us from being able to review and help you with your data. So now, we've got some settings set. Let's talk about just a very simple sort of recap here. If you forget every single thing I said today, the only thing that you need to remember from a CPAP or BiPAP setup is three things. We're gonna put some water in there, we're gonna put our mask on, and we're gonna hit start. Water, mask, start. If you can do those three things, you're getting the therapy that your physician wants you to get. If you have any questions, any concerns, if you come across any problems that maybe we didn't address in our videos today, please feel free to always reach out to Affordable Medical at 870-239-0997. That would reach any three of our locations. Ask for a respiratory therapist. We'd be happy to help you. Now that we've discussed the general use of the machine and how to adjust the settings, let's talk about the care and cleaning of your equipment. So you have a mask of any kind that you'll need to care and clean for. Cleaning will be the same no matter the type of mask. You have a humidifier that you need to clean, your tubing, whichever type you have, and your filter, which we discussed in the video earlier if you were watching. So with your filter, let's briefly go over it again. You have a disposable filter. It's not washable. I really want to drive that home, let you guys know that if you wash it, it will clog up. So we provide you 6 filters to get you started. Now, most insurances view that as a 3-month supply, but I do want to let you know that it really depends on where you live, on how often you need to change it. The manufacturer guidelines do say every 2 weeks or twice a month, however. No top or bottom, doesn't matter how you set it in there, just set it back in your machine. The idea behind the filter is check it. So if you think it's dirty, it might be dirty. Pop it out, take a look at it. If it looks dirty and dingy, it's probably time to throw it away and put your new one in there. The good news is you can always purchase those filters at our company or companies like us. You can get them just about anywhere. Now with your tubing, the tubing requires that you clean it with warm soapy water. The manufacturer's guidelines suggest what they call a general detergent or a really soft detergent. They just mean a soap that isn't gonna really beat up on the plastic in the tubing. Something that might be easy to think about would be like a baby shampoo. But while something like a Palmolive or a Dawn, some sort of name brand cleaning detergent, might really be harsh on your equipment. So you want to use a gentle or general detergent, clean it with some warm soapy water. You can run it through your tubing here, but you want to make sure that you don't get the end of your connector there wet because it can cause it to malfunction. Run your warm soapy water through it or let it soak. Hang up in your shower to air dry. The importance of any tubing, whether you have universal tubing or a heated climate control tubing, is that we dry out moisture. So even if you're someone who chooses not to use warm water and detergent because you don't want to affect that connector, you want to make sure that if you ever notice moisture, that you're drying it out. And the best way to do that is just to hang it over your shower head, let it dry for the day, and make sure that we're not getting any sort of mildew buildup. With your water chamber, squeeze and just kind of wiggle and it'll come out. You pop it open right there. Warm soapy water, gentle detergent again. Most manufacturers recommend that you clean it with a soft bristled toothbrush to make sure that you get into all the nooks and crannies, which is good because there are a lot of them. Make sure that you're cleaning this and the tubing at least once a week. Now the thing here is, if you're someone who likes to clean it more, that's totally okay, but don't go longer than a week. Or if you ever use something that's not distilled water in here, you want to go ahead and clean it. So we're cleaning it frequently. As long as we're cleaning it, it should cut down on any colds or infections or anything that you might be worried about. Once you clean it, rinse it really well, get all the soap residue out, close it up, and slide it back in. Now, everyone probably has a type of mask that they prefer. This one's a full face mask, but I just want you to know, in general, the care of the mask is pretty well the same. Typically you have a place where your tube connects, you have a frame, a cushion, and then a headgear, which is a fabric portion of your mask. It's all cleanable. You use warm soapy water or gentle detergent on all of it, and keeping the silicone is really the primary goal here. Keeping the silicone clean, is the primary goal. So we want to make sure that it seals well to your face. The way that you do that is by cleaning it. So how do we do it with this one? So to disassemble a mask, most masks have something you can take apart at the front. If it doesn't come off, that's okay. You can still clean it with warm soapy water. You have a frame and a cushion. So you can separate that frame and the cushion by just pulling them apart right like that. Now it's a little bit easier to see the different components that I'm discussing. The cushion oftentimes will have silicone attached to plastic, which you can rub down with warm soapy water to get facial oils, sweat, makeup, night creams, any of that kind of stuff that you might wear or have in your skin off of the silicone. The idea is to keep it really soft and tacky in some places. You'll notice how quickly that happens with some warm soapy water. If you need to scrub this, be careful even with a toothbrush because we don't want to scratch the silicone. This is something that's recommended to be cleaned every single day. And that's just because we all have skin that does its own thing. I may have really oily skin, you may have really dry skin, but overall we have different types of skin that require us to clean our mask different ways. So the easiest way to combat that and to care for your mask is to clean it daily with warm soapy water. They do also sell CPAP wipes, which make that a little bit easier for you. It's sort of like a baby wipe, but it's made for or with the equipment and soapy residue that you don't want to get on your CPAP mask. It's instead made with soap that is good for your silicone. Now you can clean the frame and the headgear with warm soapy water as well, but do be aware that if you clean fabric, it's going to take a while to dry because it does have some foam in it to keep it soft. So you want to give it time to dry if you're really scrubbing the headgear. To put it back together, just line up the circles and set it down and you'll be ready for tonight. So if you have any questions about the general care or cleaning of your machine, as always, feel free to reach out to a respiratory therapist here at Affordable Medical. We'd be happy to go into more detail about your specific mask, offer tips and tricks, or maybe even troubleshoot some things that you're encountering that other people aren't. But either way, feel free to reach out and let us know. We'd be happy to help. So this is a lot of information to take in a short amount of time, and we get that. That's why we want to always provide the opportunity for our patients and our customers to ask questions. If you have a therapist available to you, either in person or by phone, give them a call. Here at Affordable, we always have a respiratory therapist available Monday through Friday, 9 to 5. Give us a call. We'd be happy to help you. But if you're watching from home or online, I just wanted to go over briefly a few frequently asked questions. So a really common one is, what type of mask should I get or should I wear, considering snoring or mouth breathing or whatever your particular situation is. Now, first and foremost, I have to say, we have to give you the mask that's on the prescription. So if a physician prescribes a particular type of mask, it's my duty under my medical license to follow through with that prescription. If we have the option to fit you with a different type of mask, we'll notify you of that at the time that we're helping you with the setup, and we'll let you try some different things on. So with that, when we're considering a nasal pillow versus a nasal mask versus a full face mask, there's some nuances that you need to pay attention to. With a nasal pillow mask, which is the small mask that fits in the nostrils or underneath the nostrils, the pressure can feel a little bit more forceful. The way that I typically describe this is if you have a water hose, I think most everyone has probably done this. If you have a water hose and you start covering the end with your thumb, the pressure gets higher and the water sprays harder. But we didn't change the size of the water hose and we didn't change the amount of water coming through it. We just changed the size of the outlet. Masks work the same way. So if your pressure's at 10 and you've got a really big water hose, that's not going to be as forceful as if I had a pressure at 10 on a smaller. So with a mask, if you have a smaller mask, it can feel a little more forceful even though your pressure stays the same. That doesn't ultimately affect the therapy outside of comfort, because some people don't like the sensation of a higher pressure going directly into their nasal passage. But it's different for everyone. Sometimes it just takes trying it and realizing that you don't like it before deciding to go with a nasal mask or a full face mask. With a nasal mask, the pressure gets a little bit less. With a full face mask, because it's bigger, tends to dissipate or lessen the pressure the most. That's kind of like the open water hose where I don't have a nozzle or thumb or anything on the end. That's the general idea behind it. So higher pressure, smaller mask, lower feeling pressure, I should say, for a larger mask. When choosing a mask, I commonly will get the question, well, what if my husband snores? Or what if I drop my mouth open when I'm sleeping? Well, if you're wearing a nasal mask, there are just as many studies that show that your airway can be corrected even with your mouth open, as much as it could be with your mouth closed. The issue that causes is if your mouth is opening with a nasal mask, that pressure will circulate and you'll end up a lot of times with drier mouth or like a drier throat. Not every time, everybody's different, but do be aware that can happen. The therapy may still be working and you may have some dry mouth, or in some instances, again, because everybody's different, you might find that the nasal mask isn't making you feel better, even though our data looks good, even though we're showing that the AHIs and apneas and things like that are corrected. So it's always important that with any symptom or how you're feeling, that you're reaching out to your physician, that you're following up with your doctor the way that you're supposed to, and that you're reaching out to our respiratory therapist to help you. Nasal masks are the same way. You can circulate that air out of your mouth. So that moves into the benefit of a full face mask. Yes, it's larger. Yes, the pressure doesn't feel as forceful. It's a little bit harder to seal just because we're touching more of the face, but people are oftentimes pleasantly surprised at how much more comfortable they are because it feels like it's a lower pressure and because they can choose to breathe in and out of their mouth if they want. So on a nasal mask, we need to breathe through our nose. Full face mask, we breathe through our nose and mouth, whichever we prefer. Now, moving on, chin straps. That's a really common one. So what if I choose a nasal mask, but my mouth is coming open, I find that I'm a little dry and I want to try a chin strap before moving to a full face mask? Well, that's okay. We have some chin straps that we can offer you. You can find a lot of different kinds online. We carry 2 or 3 different types here at our Paragould location and our Jonesboro location. With a chin strap, the idea behind it is we're just keeping our mouth closed. So it's not about a lot of tension. It's not about really strapping it too tight, but it's just keeping your jaw from dropping open so that air pressure doesn't circulate. I'm not a huge fan of chin straps. I think every person, deserves the opportunity to try it themselves if that's something they're interested in. But just as a therapist, I have seen that over time, people who are wearing a chin strap tend to just lean towards a full face mask because they think, if I'm gonna have to strap this stuff all over my head, why wouldn't I just move over to the next mask and be done with it? But again, there's options out there. There's not really a wrong choice as long as you're comfortable. That's always the key. Do you feel better? Are you comfortable? If we're not getting you feeling better, if we're not getting you comfortable with your therapy, then we really need to make some adjustments to try to help you there. Now, a common question about cleaning, I get this one a lot. Can I clean my equipment with vinegar? Well, it's sort of a hard question because the manufacturer's guidelines say no. The manufacturer's guidelines say you should use warm soapy water, a gentle detergent, with all of your supplies, right? We discussed that if you watched the video or the portion on cleaning and caring for your supplies. I will admit, I've had a lot of patients who have used distilled white vinegar in a 1 to 3 or 1 to 4 solution with distilled water, so they're diluting the solution down to clean their equipment. I can't personally recommend it just because it's not a manufacturer's guideline, but I do want to admit and let you know that I have had a lot of patients successfully do that. The important thing to know about vinegar and water and soap and water is vinegar has to soak. The only way that a vinegar solution cleans your equipment is through soaking. So if you're scrubbing with it, it's not going to do the job the way that it needs to. It needs to soak for about 45 minutes or longer. If you soak it too long, it can eat away at the equipment. It can even leave a smell. So that's where some of that concern comes into play there. Reach out to the manufacturer of the machine that you have and ask those questions to them directly to make sure that you're not voiding your warranties or that you're not causing any damage to your machine. Now with warm soapy water, as the manufacturer suggests, we have to scrub. So 1, you're soaking, and 1, you're scrubbing. We have to have a scrubbing action with soap, generally for 20 seconds or longer for it to do any good. You can soak it in warm soapy water to loosen up any debris. That is beneficial, but you at some point do want to scrub to remove that debris and clean some of the spaces of your machine there. Again, always refer to your user manual. Always clean your equipment according to manufacturer guidelines. If you're ever unsure, feel free to call us or reach out to the manufacturer about your specific machine and cleaning requirements. If you come up with any other questions that we've not covered in the video or in this quick question and answer time, ask your therapist, give us a call, reach out to us on Facebook or our website. We're always available to you. Be happy to help.